Autism. Embracing diversity. Tailored intervention for distinct journeys. Comprehensive practices. Tailored support and intervention. Autistic individuals have access to a variety of services and therapies tailored to their specific needs and challenges. These options emphasize the importance of personalized support and interventions, catering to the unique needs and strengths of each individual on the autism spectrum. By recognizing and addressing the diverse experiences and challenges faced by autistic individuals, these tailored approaches aim to empower them to reach their full potential and lead fulfilling lives. Standard services and therapies for autistic individuals include applied behavior analysis (ABA), assistive technology, cognitive behavioral therapy (CBT), educational support services, family counseling, medical, nursing, and nutrition services, occupational therapy (OT), physical therapy (PT), picture exchange communication system (PECS), social skills training (SST), and speech and language therapy. Comprehensive practices. At a glance. Applied behavior analysis (ABA). Reinforced behavior modification. Applied behavior analysis (ABA) is a structured, evidence-based approach designed to understand and modify behavior by using the following strategies. Breaking down tasks. Promoting positive behavioral changes by increasing preferred behaviors and decreasing harmful ones. Tailoring interventions to individual needs and goals. Targeting improvements in communication, social skills, academic performance, and daily living abilities. And using positive reinforcement. This approach helps achieve meaningful and lasting behavioral changes. Applied behavior analysis (ABA). Legitimate concerns and criticisms. Concerns about the application of ABA therapy within the autism community highlight several significant criticisms, including some autistic individuals and their families consider ABA abusive. Historical ties to punishment-based techniques raise concerns about its impact on mental well-being. The high intensity and cost of ABA programs may create barriers to access for some families. Insufficient attention to individual autonomy and choice can restrict personal growth and development. Prioritizing normalization over embracing neurodiversity may overlook the unique strengths and perspectives of autistic individuals. Limited generalization of skills learned in ABA sessions to real-life situations may reduce the therapy's long-term effectiveness. And the rigid, compliance-focused approach of ABA therapy may limit individual expression and autonomy. Assistive technology. Innovative tools for the 21st century. Assistive technology provides valuable tools to aid autistic individuals in different facets of their lives, promoting independence and enhancing their overall well-being. Common technologies include communication aids, including speech-generating devices and apps that help nonverbal individuals express themselves and communicate effectively. Educational software, including interactive programs tailored to individual learning styles that support academic progress and skill development. Environmental control systems. Smart home technology allows individuals to control their environment, adjusting lighting, temperature, and other factors to meet their sensory needs and preferences. Gaming and recreational apps. Therapeutic gaming apps and recreational activities promote engagement, skill building, and relaxation in a fun and motivating way. Organizational apps designed for task management, scheduling, and visual support help individuals with executive functioning difficulties stay organized and focused. Sensory tools, including noise-canceling headphones, weighted blankets, and sensory apps, help manage sensory sensitivities and promote relaxation. Social skills apps offer interactive lessons and activities to enhance social understanding, conversation skills, and emotional regulation. Virtual reality therapy platforms offer immersive environments for exposure therapy and social skills training, providing safe and controlled settings for practice and learning. Wearable technology devices, like smartwatches with reminders and tracking features, promote independence and routine adherence. Cognitive behavioral therapy, CBT. Shifting negative thoughts to positive mindsets. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach for autistic individuals. It focuses on understanding and managing thoughts, feelings, and behaviors by utilizing the following. Anxiety management. CBT techniques help individuals identify and manage anxiety symptoms, including relaxation techniques, cognitive restructuring, and gradual exposure to feared stimuli. Behavior modification. CBT aims to modify problematic behaviors and promote more adaptive coping strategies through reinforcement and exposure. Cognitive restructuring. CBT helps individuals recognize and challenge negative or distorted thoughts and beliefs, promoting more adaptive thinking patterns. Collaborative approach. CBT is a therapy that values the input and participation of both the therapist and the individual. Together, they set goals, develop treatment plans, and implement strategies, fostering a sense of shared responsibility and progress. Emotional regulation. CBT teaches individuals strategies to identify and regulate emotions, including mindfulness exercises, emotion labeling, and coping skills training. Exposure and desensitization. In cases of anxiety disorders, phobias, or PTSD, CBT may use exposure techniques to confront fears and reduce anxiety over time gradually. Homework and skills practice. CBT often includes homework assignments and skill-building exercises that individuals practice between therapy sessions to reinforce learning and progress. Individualized treatment plans. Individualized treatment plans meet each individual's unique needs and goals, with therapy sessions focusing on specific areas of difficulty and building on strengths. Parent training. CBT may involve training parents or caregivers in CBT techniques to support their child's progress and generalize skills learned in therapy to the home environment. Problem-solving skills. CBT helps individuals develop problem-solving skills to effectively address challenges and navigate daily situations. Social skills training. CBT interventions often include training to help individuals improve their ability to navigate social situations, understand social cues, and develop practical communication skills. Cognitive behavioral therapy, CBT. Legitimate concerns and criticisms. Critics of cognitive behavioral therapy, CBT, for autistic individuals highlight several concerns, including focus on conformity. CBT's emphasis on conforming to societal norms may conflict with the neurodiversity paradigm, which advocates for accepting and celebrating neurodivergent traits. Challenges with generalization. Skills learned during CBT sessions may not always transfer to real-life situations, limiting the therapy's long-term effectiveness in addressing everyday challenges. Lack of individualization. CBT interventions may not adequately account for the individual differences and unique needs of autistic individuals, leading to a one-size-fits-all approach that may not fully address their specific concerns. Limited applicability. CBT may not be suitable for all autistic individuals, especially those with significant communication or cognitive impairments, due to its reliance on verbal communication and abstract thinking skills. Narrowed focus on sensory issues. CBT may not effectively address sensory sensitivities commonly experienced by autistics, potentially overlooking significant sources of distress and anxiety. Need for adaptation. Critics suggest that therapists should adapt CBT interventions to accommodate the needs and preferences of autistic individuals, such as incorporating visual supports and alternative communication methods. And rigidity and structure. The structured nature of CBT may be perceived as overly rigid by some autistics, leading to resistance or disengagement from therapy. Educational support services. Personalized assistance for learning environments. Educational support services are crucial in providing tailored assistance to autistic individuals, fostering their academic success and overall development. Common educational support services include assistive technology. Utilizing assistive technology tools and devices can enhance access to educational materials, support communication, and facilitate academic engagement for autistic students. Behavioral support strategies. Implementing behavioral support strategies helps manage challenging behaviors and promotes positive behavior within the educational setting, creating a conducive learning environment for autistic individuals. Individualized education plans, IEPs. Educational support services often involve the development and implementation of IEPs, which outline specific goals, accommodations, and services tailored to meet the unique needs of each autistic student. Sensory accommodations. Educational support services may include sensory accommodations to address sensory sensitivities and promote comfort within the learning environment, such as providing noise-reducing headphones or sensory-friendly classroom spaces. Social skills training. Interventions focused on social skills development aim to improve social interaction, communication, and peer relationships for autistic students, fostering meaningful connections and participation in social activities. Special education programs. Autistic individuals may benefit from specialized programs within the unique education framework, offering a supportive learning environment with trained professionals and targeted interventions. Transition planning. Educational support services also involve transition planning to facilitate smooth transitions between educational stages or into post-secondary education, vocational training, or employment opportunities for autistic individuals. 504 Plan. The 504 Plan provides accommodations and support services for students with disabilities, enabling them to access educational programs and activities equally with their peers, without needing specialized instruction. 504 Plan versus IEP, Individualized Education Program. Understanding the difference, at a glance. A 504 Plan and an IEP, Individualized Education Program, are educational support plans designed to meet the needs of students with disabilities, including autistic individuals. As an ally, it is essential to understand the critical differences in their purpose, eligibility, scope of services, and legal protections. The 504 Plan provides accommodations to ensure equal access to education for students with disabilities who do not require special education services. The IEP is more comprehensive and tailored to students requiring specialized instruction. '504 Plan versus Individualized Education Program, IEP. Purpose. Created under Section 504 of the Rehabilitation Act of 1973, a 504 Plan provides accommodations and support services to students with disabilities who do not qualify for special education but require assistance. Individuals with a 504 Plan are ensured a free and appropriate education, known as FAPE, and receive access to educational programs and activities on an equal basis with their peers. An IEP is a legally binding document developed for students who qualify for special education services under the Individuals with Disabilities Education Act, IDEA. It outlines specific educational goals, services, and accommodations necessary to support the student's academic and developmental needs, while ensuring that the student receives a free and appropriate public education, FAPE, in the least restrictive environment. 504 Plan versus Individualized Education Program, IEP. Eligibility. Eligibility for a 504 plan includes students with disabilities that significantly limit one or more major life activities, such as learning, walking, seeing, or hearing. These conditions can include autism, ADHD, and mental health disorders. To qualify, a student's disability must substantially impact their ability to perform these activities compared to their peers. To qualify for an IEP, a student must meet the criteria for one or more of the 13 disability categories defined by IDEA and show that their disability negatively impacts their educational performance, necessitating specialized instruction and support. These 13 disability categories include autism spectrum disorder, ASD, deafness, deafblindness, emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, speech or language impairment, traumatic brain injury, and visual impairment, including blindness. 504 Plan versus Individualized Education Program, IEP. Scope of services. A 504 plan primarily focuses on providing accommodations and support to eliminate barriers to learning, ensuring equal access to educational opportunities. This may involve modifications to the physical environment, classroom procedure adjustments, extended test time, or access to assistive technology. An IEP offers a comprehensive array of services, including specialized instruction, related services like speech or occupational therapy, accommodations, curriculum modifications, and specific annual goals designed to meet the student's needs. 504 Plan versus Individualized Education Program, IEP. Legal protections. 504 plans are governed by the Federal Civil Rights Act and the Americans with Disabilities Act, ADA, which provide lifetime legal protections against disability-based discrimination. While they do not offer all the procedural safeguards of IEPs, 504 plans still ensure legal protections by ensuring students receive the necessary accommodations to participate fully in school activities. These legal protections extend beyond high school under a 504 plan, covering settings such as colleges, universities, vocational training programs, and other post-secondary institutions. They ensure that individuals with disabilities receive reasonable accommodations to fully engage in academic programs and activities. Governed by the Individuals with Disabilities Education Act, IDEA, and the Americans with Disabilities Act, ADA, an Individualized Education Program, IEP, provides legal protections primarily within the K-12 educational system. These protections include free appropriate public education, FAPE. This right ensures a fair and appropriate public education tailored to the student's needs at no cost to the parents, providing a sense of reassurance and security. Appropriate evaluation. This right underscores the value and respect for the student's needs, ensuring a comprehensive assessment in all areas of the suspected disability to determine educational needs. Individualized Education Program, IEP. The right to have an individualized education program developed, reviewed, and revised annually. This includes specific educational goals, services, and accommodations to meet students' unique needs. Parental participation. The right for parents to participate in the development and review of their child's IEP. Procedural safeguards. The right to procedural safeguards to protect the rights of the student and parents, including the right to resolve disputes through mediation or due process. Least restrictive environment, LRE. The right for students to be educated with non-disabled peers to the maximum extent appropriate. These protections do not automatically continue under IDEA after high school. However, students with disabilities, transitioning to post-secondary education or employment, may still be entitled to accommodations and support under Section 504 of the Rehabilitation Act of 1973 and the Americans with Disabilities Act, ADA. These laws ensure that individuals with disabilities receive equal opportunities in post-secondary settings and workplaces. Family counseling. Vital support and guidance. Family counseling provides crucial support and guidance to families navigating the challenges associated with autism. It creates a collaborative and supportive environment aimed at strengthening familial relationships, improving communication, and enhancing the overall well-being of autistic individuals and their families through the following approaches. Advocacy and support. Family counseling provides families with resources, information, and advocacy support to navigate educational, healthcare, and community services effectively on behalf of their autistic family member. Coping strategies. Family counseling equips families with coping strategies and resilience-building techniques to manage stress, anxiety, and other emotional challenges associated with caring for an autistic family member. Effective communication. Through family counseling sessions, families learn strategies to improve communication skills, express emotions constructively, and resolve conflicts in a supportive and empathetic manner. Empowerment and resilience. Family counseling empowers families to build resilience, foster acceptance, and thrive in their journey with autism by promoting open communication, mutual understanding, and shared problem-solving. Enhanced understanding. Family counseling facilitates a deeper understanding of autism, its impact on family dynamics, and each family member's unique strengths and challenges. Individual and family goals. Counselors work collaboratively with families to identify individual and family goals, develop personalized intervention plans, and foster a supportive environment for achieving these objectives. In summary, family counseling enables families of autistic individuals to cultivate stronger relationships, improve coping skills, and establish supportive environments that contribute to the holistic well-being of all family members. Medical, nursing, and nutrition services. Crucial comprehensive care and support. Medical, nursing, and nutrition services are crucial in providing comprehensive care and support for autistic individuals, addressing their unique healthcare needs, and promoting overall well-being. These services encompass a range of medical interventions, nursing care, and nutritional guidance and may include collaborative care coordination. Medical, nursing, and nutrition services operate within a multidisciplinary framework, collaborating with other healthcare professionals, therapists, educators, and caregivers to provide coordinated and holistic care to autistic individuals. This collaborative approach ensures continuity of care, individualized treatment planning, and optimal health outcomes. Feeding therapy. For individuals with feeding difficulties or selective eating patterns, feeding therapy interventions aim to improve mealtime behaviors, expand food repertoire, increase food acceptance, and promote positive mealtime experiences. Feeding therapists employ techniques, sensory approaches, and behavioral strategies to address underlying factors that contribute to feeding issues and ensure adequate nutrition intake. Medical evaluation and management. Healthcare professionals conduct thorough medical evaluations to assess the physical health, developmental milestones, and potential co-occurring conditions of autistic individuals. This includes diagnosing and managing medical issues such as gastrointestinal problems, sleep disturbances, epilepsy, and sensory sensitivities. Medication management. Medical services involve the judicious use of medications to address symptoms associated with autism, such as anxiety, impulsivity, aggression, and attention deficits. Healthcare providers carefully monitor medication efficacy, side effects, and dosage adjustments to optimize treatment outcomes while minimizing adverse effects. Nursing care and support. Nurses are vital in delivering compassionate and holistic care to autistic individuals. They assist with medication administration, health monitoring, symptom management, and coordination of healthcare services. They also offer education and support to families regarding medication adherence, symptom recognition, and emergency response protocols. Nutritional assessment and guidance. Nutrition services conduct thorough nutritional assessments and identify dietary preferences, sensitivities, and nutritional deficiencies. They develop individualized plans to support nutritional needs, optimal health, and wellness. Dietitians offer guidance on balanced diets, food preferences, meal planning, and strategies to address the feeding challenges commonly observed in autistic individuals. By integrating medical, nursing, and nutrition services into the care continuum for autistic individuals, healthcare providers can address their diverse healthcare needs, enhance their quality of life, and promote their overall health and well-being. Occupational therapy, OT. Holistic approaches addressing unique needs. Occupational therapy helps autistic individuals by building essential skills, boosting independence, and improving the overall quality of life. Therapists use a comprehensive and holistic approach to address a range of needs with techniques, including adaptive equipment and environmental modifications. Occupational therapists provide recommendations and tools, such as sensory-friendly accommodations, ergonomic seating, adaptive utensils, and visual supports, tailored to enhance independence in daily activities. Executive functioning support. Occupational therapy addresses challenges related to executive functioning skills, such as organization, planning, time management, and problem-solving. Therapists utilize strategies to improve individuals' executive functioning abilities, enhance cognitive flexibility, and promote independence in managing daily tasks and responsibilities. Family education and support. Occupational therapists work with families to educate, train, and support them in implementing strategies that promote individuals' progress and participation in daily activities at home, school, and the community. These family-centered interventions empower families to advocate for their loved ones and support their ongoing development and well-being. Motor skills development. Occupational therapy targets fine and gross motor skills, crucial for daily activities, self-care, and everyday tasks. Therapists improve hand-eye coordination, motor planning, bilateral coordination, and motor control to help individuals improve functions like writing, dressing, and grooming. Sensory integration therapy. Occupational therapists use structured activities to help individuals process sensory information more effectively, regulate responses, and reduce sensitivities. Social skills training. Occupational therapists facilitate social skills development and interpersonal communication abilities through structured social skills training programs. These programs target turn-taking, initiating and maintaining conversations, understanding social cues, and developing peer relationships to promote social inclusion and interaction. Transition planning and vocational support. Occupational therapy helps autistic individuals transition to adulthood and navigate post-secondary education, employment, and community living. Therapists provide vocational assessments, job coaching, workplace accommodations, and training in independent living skills to help individuals successfully transition to adulthood and integrate into the community. Through comprehensive occupational therapy services, autistic individuals can enhance their sensory processing, motor skills, social interactions, and overall participation in daily activities, improving their independence, confidence, and quality of life. Physical therapy. Promoting daily independence and participation. Physical therapy addresses motor skills, coordination, flexibility, and sensory integration challenges to promote independence and participation in daily activities. Key approaches include adaptive equipment and assistive devices. Therapists may recommend and facilitate using adaptive equipment and assistive devices to support mobility, safety, and independence in daily activities. Coordination and balance. Physical therapy interventions target coordination and balance deficits, helping individuals navigate their environment more easily and confidently. Flexibility and strength training. Physical therapists improve flexibility, muscle strength, and endurance through targeted exercises and stretching routines, enhancing overall physical function and reducing the risk of injuries. Home exercise programs. Physical therapists collaborate with families to develop personalized home exercise programs, empowering them to continue therapeutic interventions outside clinical sessions and integrate therapeutic activities into daily routines. Motor skills development. Physical therapy focuses on improving gross motor skills, such as walking, running, jumping, and balance, as well as fine motor skills, such as hand-eye coordination and manipulation. Sensory integration. Therapists use sensory integration techniques to help autistic individuals process and respond to sensory input more effectively, reducing sensitivities and enhancing sensory regulation. Picture Exchange Communication System, PECS. Promoting daily independence and participation. Picture Exchange Communication System, PECS, is a widely used augmentative and alternative communication method designed to support autistic individuals. Utilizing visual symbols to help individuals express their needs, desires, and thoughts effectively, the use of PECS supports autistic individuals by encouraging social interaction. PECS fosters social interaction by facilitating communication exchanges between individuals and their communication partners, promoting engagement and social reciprocity. Facilitating visual communication. PECS uses pictures or symbols to facilitate communication, allowing individuals to express their needs, desires, and thoughts by selecting and exchanging relevant images. Influencing sequential learning. The PECS protocol involves a structured approach that teaches individuals to initiate communication by exchanging a picture for a desired item or action, gradually progressing to more complex communication exchanges. Promoting language development. PECS uses visual supports to help individuals develop language skills, including vocabulary acquisition, sentence structure, and expressive language abilities. Providing an individualized communication approach. Tailored PECS interventions meet each individual's unique communication needs and abilities, allowing for personalized strategies and adaptations to optimize communication outcomes. Social skills training. Supporting positive social interactions and relationships. Social skills training helps autistic individuals develop essential skills for successful social interactions and relationships. Using structured lessons and practice sessions, individuals learn to enhance social communication, understand social cues better, and navigate social situations effectively. Targeted areas include family involvement. Involving families in social skills training allows for consistently reinforcing learned skills at home and in the community, fostering ongoing social development and support for autistic individuals. Generalization of skills. Social skills training aims to generalize learned skills from therapy sessions to real-life situations, empowering autistics to apply their social skills in various social settings and contexts. Peer interaction. Group-based social skills training provides opportunities for autistic individuals to practice social skills in real-life settings with peers, facilitating social interaction, friendship development, and peer acceptance. Role-playing and modeling. Therapists often use role-playing and modeling techniques to demonstrate appropriate social behaviors and interactions, allowing autistics to observe and practice these skills in a supportive environment. Skill acquisition. Social skills training programs target specific social skills and behaviors common for autistic individuals, including initiating conversations, maintaining eye contact, understanding social cues, and taking turns. Social scripts and stories. Social skills training may incorporate social scripts and stories to help autistics understand social norms, expectations, and appropriate responses in different social contexts. Speech and language therapy. Crucial strategies for everyday communication. Speech and language therapy is crucial for autistic individuals to improve their communication skills, verbal expression, and language comprehension. Tailored techniques and strategies include articulation and speech clarity. Therapists address articulation difficulties and speech clarity issues, helping autistic individuals produce sounds and words accurately to enhance their intelligibility and communication effectiveness. Augmentative and alternative communication, AAC. Speech therapists may introduce AAC systems, such as picture exchange communication systems, PECs, or electronic devices, to support nonverbal individuals in expressing their thoughts, needs, and preferences. Fluency and rhythm. Speech and language therapy may address fluency disorders, such as stuttering and rhythm difficulties, helping individuals improve their speech fluency and prosody for greater clarity and natural communication. Individualized treatment plans. Speech therapists design individualized treatment plans tailored to the specific needs, strengths, and goals of each autistic individual, with interventions adapted based on their age, language level, and communication challenges. Language development. Speech and language therapy focuses on developing language skills, including vocabulary expansion, sentence structure, and understanding of language concepts, to facilitate effective communication. Parent and caregiver involvement. Families play an integral role in speech and language therapy, as therapists provide guidance and training to parents and caregivers on supporting and reinforcing communication skills at home. Pragmatic language skills. Autistic individuals develop pragmatic language skills, including understanding conversational rules, appropriate language in different social contexts, and interpreting figurative language to improve their social communication abilities. Social communication. Autistic individuals learn social communication skills, such as turn-taking, initiating and maintaining conversations, listening comprehension, and interpreting nonverbal cues, to navigate social interactions more successfully.